Welcome to another episode of Candid Conversations with Dr. Kelly. This is another episode of Candid Questions. So it's just me again. So if you have listened before, you are an avid listener of the podcast, welcome back. Thank you for your support. But you know that for Candid Questions, I open your questions blindly that have been sent in, that my fabulous team has compiled for me, and they keep them in a document. They send the link to me, I open it, and go for it. So, without further ado, here we go. Okay. I feel like this is Candid Questions After Dark, but it's not. You all will listen to this, at any time of the day, but it is quite early in the morning. But we are up and getting it done. So the questions are organized by sections, and since I don't have a candid questionnaire, I mean, I guess the whole thing is candid questionnaires for me, but there aren't a lot of personal gems in here. So what I'm going to do this time is read the questions that are specifically about speech, and then towards the end, I'll choose a couple from the personal questions where they want to know, or you all have asked questions about me, which is super interesting. I feel very much like I'm just me. Like, who cares what I'm doing? Who cares? But it's an honor that there are people who do care. And so I am happy to share. So it's not like I can hop around. I have to take what is at the top because, like I said, I don't screen them. And if I pop around and choose which questions I want to answer, then that's not very candid now, is it? So, I mean, who knows? Maybe it is. But, anyways, here we go. First question about all things SLP. First one out the gate. Let's see what you guys have for me. Normally, you guys have such great questions. First one. Can you please explain the part where SLPs can refer kids to a neuro-ophthalmologist? All right, sure I can. So, speech-language pathologists can make referrals to whatever medical professional is necessary or appropriate. And that is as simple as having the clinical judgment to determine that a referral is needed. We, as speech-language pathologists, are equipped with the education and knowledge of what other medical professionals do. You may hear a lot of us talk about interprofessional collaboration, and that is a super duper fancy term for working together, if I'm being honest. Working together as a medical team, because our goal as providers is to make sure that you, the patient, and you're asking about kids. So, you as the patient or your child or loved one as the patient are our main goal. So we all work together for that main goal, which is to provide that patient with the best care possible. So an SLP can make a referral by verbally making the recommendation or saying, I'm going to refer you. And when they refer, it could mean that they provide you with the information of the medical provider. In this case, it's a neuro-ophthalmologist. And that can be that a speech-language pathologist works in the space. So if it's like a medical SLP who works in this space, then they would have or should have knowledge of the neuro-ophthalmologists that are available to the patient. And that can be as simple as they already have a list prepared of providers in the area, or it could be that they need to do some research and find an neuro-ophthalmologist that is appropriate for your kiddo. So referrals, it's essentially the speech-language pathologist providing information or contact information to the individual, or calling a neuro-ophthalmologist's office or another medical professional's office and finding out more information, or actually saying, hey, I'm referring a patient to you, can you reach out to them, and or sending them their information. And it can be as simple as that. SLPs do not write prescriptions or anything like that. So we write orders for doctors to sign that can change a patient's diet or something like that. But a referral can be as simple as a phone call or providing you with the provider that is most appropriate. Good question. Next up, is it a good idea to get background info on our patients, like asking about history of playing sports on intake sheets? Yes. Yes, it is a fantastic idea. I say necessary. I think that we should have that question on all intake forms because it can give such insight to a person's behavior, to potential symptoms that they're experiencing, and can give SLPs and other providers a great insight into what could be going on with them and what they are potentially being seen for. So, absolutely. I think that that should be a thing. And I also think that not even on intake sheets, but on documents like for pediatric SLPs or school-based SLPs, when I do my talks, a lot of times when there are school-based SLPs in the audience, which is quite often, I'm so grateful for the support from my school-based SLPs. Love you guys. And they will hear the information. And I give this example of an SLP that was in California, and she is well versed in TBI and concussion. And she was in an IEP meeting, and there was a bunch of discussion about this particular child. And they were saying that they'd done everything. They just couldn't figure out what was going on. The medications weren't working. The attempts that they were making to accommodate the child weren't working. And this SLP with knowledge of TBI asked the mom, well, has your child ever, had a head injury or anything? And the mom immediately said, no, never. And she stopped and she thought about it and she paused and she said, well, there was that one time that the TV fell on his head. And in my mind, I'm thinking, ding, 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 ding. But those kinds of things people don't even think about because of, oh, it's quote unquote just a concussion, or they're fine. And if it happened when they were younger and the child wasn't educated or made aware of what to say regarding their brain or what they saw, they may have said, Mommy, I saw a flash, or, I'm sure that they cried. But you don't know what you don't know. And that's why I do the work through Brain Talk Foundation, because I believe that everybody needs to know this information about concussion and brain injury, traumatic brain injury, because we're all at risk for a concussion. So we all need to know about it. We all need to know the signs so that we're not brushing things off, because it does not have to be all sports related to where we are at risk for concussion. Yes, I am a former athlete. I know a lot of athletes. I speak with and interview a lot of athletes, and that absolutely significantly increases your risk for concussion depending upon the sport that you're in. But the number one cause of concussions are falls, and we all could fall. We could trip, we could stumble, which results in a fall. It could be you're sitting in a chair and you lose balance and you fall. That has actually happened, and there will be a podcast guest who talks about that. But I believe that we all should be disclosing that kind of information, not just on intake sheets, but maybe not applications, but things with daycare, definitely IEP meetings. So not necessarily specifically intake sheets for medical purposes, but I think that information should be provided when accommodations and support can be introduced for situations like that. But, we are really still building these things. And because there is not a lot of structure and framework and things that are built, systems that are built, we're doing it now. So that's a really good question, because that makes me think, like, where else besides intake forms can that information be shared? Because I'm a huge proponent of advocacy and self-advocacy, but to an extent when, people are comfortable with it, because you don't have to disclose what you're experiencing if you don't want to. So I say make it an option in some situations, but again, still working all of that out. I'm going to stop talking and go to the next question. Can you share more about what therapy looks like for individuals with TBI or suspected CTE? Specifically, what interventions or approaches SLPs might use? All right. This is a great question, and a popular one, and a loaded one. So, for starters, with suspected CTE, that is, I will say, for everything, really. It depends. It depends on the patient. It depends on their needs. So I will do my best to give you some general exercises that I use in my therapy sessions that I have found functional. But I urge all of my SLPs out there and people who may be patients or know a loved one who is a patient. It's important that therapy is functional, okay? And what I mean by that is it needs to be applicable to your life so that you're not, scribbling on a worksheet and calling that therapy. And as I say all the time, that is no shade to worksheets, because people have created them. I think there are great products on Teachers Pay Teachers and things like that. There is a time and a place for worksheets, and I have used workbooks and things like that to an extent. But the functional piece that I'm speaking to is, if you're a sports fan, incorporate the sports, because that's going to motivate the patient to participate. If it is a mom with a busy schedule and the concussion or brain injury has impacted their ability to multitask and schedule things for themselves and their family, and, errors are being made, appointments are being missed, then my recommendation would be to incorporate a calendar organizing or task organizing exercise to help strengthen that skill again, and also provide some compensatory strategies to help. And compensatory strategies are just that. They are strategies to help compensate for where the deficits are showing up. So in this example, it would be missing appointments and having a tough time with organizing things on the calendar. So with a compensatory strategy for that, that might be incorporating an AI component like Alexa or Siri. Sorry if I'm waking those up for for whoever's listening. But it could be incorporating something like that so that you have an assistant, essentially. I tell my patients, consider these devices like your personal assistant, because you can add things to a shopping list or a packing list if you are traveling. And you can ask for reminders for appointments. I speak about a particular patient, well, a couple of patients when you're working with individuals with brain injury, but I can think of patients who will set reminders for 5 minutes for our sessions, and that span of time is still too long, because they will either be sitting in front of the computer and forget why they're there, get distracted, start scrolling social media, checking emails, and they completely forget that we have a session. And I have been in situations where I have waited for a patient, and that window of time that I allow for tardiness, things happen, life happens. And I'll wait for an extended period of time because I have grace for my patients who have brain injuries. And I will text them. Sometimes I can even text them and they still won't get it. And an hour or so later, I'll get the frantic text or call, the apologies. And, that can take a toll on someone's mental health. But we'll, get back into that later on if someone asks about that. I have a quick question for all of my fellow speech-language pathologists. Are you on the hunt for fun, functional, and diverse therapy materials for both your pediatric and adult clients? Well, let me put you on to something I absolutely love and use in my private practice: Cognishine. If you haven't heard of it yet, Cognishine is a digital platform designed to support speech, language, memory, attention, executive function, and more. It's science-backed, clinically effective, and works beautifully for both teletherapy and in-person sessions. But what really makes Cognishine shine? It's completely customizable. You can tailor exercises to your client's specific needs, whether you're targeting speech sounds, supporting recovery after a concussion, or strengthening cognitive skills post-stroke. It's become a game changer in my sessions, and my clients absolutely love it. So, if you're looking for a tool to elevate your therapy, check out Cognishine and tell them Dr. Kelly sent you. Another exercise could be word finding. So someone having a difficult time with finding the name for objects or the name for people in their lives. So if you're wanting to ask for the television remote, you may say, "Hey, can you pass me the whatchamacallit?" And the word could be on the tip of your tongue, as we say, and it's just not coming. Part of therapy is not allowing your patients to give up in that moment. So I have my patients work for that word, dig for that word, and or memory. So not just the word, the memory. I will have them use context clues from what they can remember to find a specific memory. That could be about an event. So what did you have for lunch last night? Not, I did say it was early in the morning. Sorry. What did you have for dinner last night? Lunch. Oh, silly rabbit. Okay. What did you have for dinner last night? And if my patient says, I don't know, I can't remember. Well, I don't let them stop there. That's giving your brain permission to quit. Because if you can say, I don't remember that, and be done with it and be prepared to move on with the conversation, absolutely not. This is therapy. You are going to work in here. So I will tell them, okay, well, let's find it. Let's figure it out. So I can have them imagine or think about the night before. Did you eat by yourself or did you eat with somebody else? And then they'll think, oh yeah, like I ate with my mom. Or I'll ask, did you order in or was the food cooked at home? I'll ask if they had a plate or if they ate their food out of a bowl. And I'll ask about their beverage. I'll ask if they helped with cleanup, what they did immediately after. And so they will basically use memory breadcrumbs, if you will, to piece their way and pull their way back to that memory. And oftentimes when we're doing that exercise, they will unlock that memory and they'll say, oh yeah, we had spaghetti because I spilled some of that sauce on my pants. And I remember that I thought it was weird that my mom, gave me a spoon to eat the noodles instead of a fork. So I had to get up and go to the drawer, so that works to unlock that memory. So I call it, kind of using breadcrumbs to get back. But that is an example of a therapy exercise that I will do. So I don't let patients quit. I make sure that we work through as best as we can to find that memory, because that is going to be a skill that I use for more challenging exercises. So that is something that is a part of their life what they had for dinner. But if I apply an activity or an exercise, like something that could come from a worksheet, or like looking at functional pictures. It could be family members that I've asked for them or a loved one that they are okay being involved in their care to provide me with. And we'll go through, it could be images of things in their home. It could be family members of theirs, friends, members of their, employment team that they're having a tough time remembering names. So that's what I mean by function. And there are so many different exercises that I could get into. That could be an entire Candid Questions episode. That's okay. I'm thinking about that. So maybe I'll do that and I'll think of multiple exercises that can be done, because that is something that I get asked a lot. And that is something that it's like a knife in my heart. That is one of the things that SLPs will say on reviews. So a lot of people, when I get my feedback, when I do talks, will talk about how life-changing the talk is and how wonderful it is. But there are those who say they want more of the treatment exercises that I do with my patients. And it's just so hard to please everybody. And I do my very best. I appreciate those who, talk about how wonderful my talks are or my courses are. I'm so grateful to you. And the others who have the feedback that they want more on treatment, I so appreciate you all too, because that helps me shape my talks and courses to be more of what it is that you're asking for. So I thank you all for the feedback that you provide, and I appreciate that it is mostly constructive. Um, so thank you. I know that I can't please everybody. I am a recovering people pleaser, so I'm going to be honest, I do try, but through work and therapy and brain health and mental health, I know that's not possible. So thank you all regardless. Moving on. How can SLPs apply this information about TBI and CTE in practical clinical ways, especially in school or outpatient settings? Okay. Mm, Remember, I do not read these ahead of time, so I'm going to give this one another read. Maybe you're driving, so I'll read it so you can hear it as well. I'll read it again. How can SLPs apply this information about TBI and CTE in practical clinical ways, especially in schools or outpatient settings? Man, I feel there are many places to go with this, because it's really, I can interpret this in multiple ways. But we don't have all day. So I'm going to interpret quickly and come up with an angle. Hmm. So applying it in practical ways can be many things that we've talked about so far in these previous questions. It can be applying it practically to implement systems and protocols. It can be implemented in school and outpatient settings by in services, educating people. I think there are a lot of individuals who are not aware of this information. And so apply this information to the people that you work with, to the people in your communities, to your family, where you go to church, if you go to church, um, your skateboard community, your choir, your bandmates. There are, like I said, everybody needs to know this information, because everybody is at risk for falls. So you can definitely apply it in that way. I believe that is practical, because a lot of people will ask, well, what's next? What do we do? And I have answers for that now. But the big piece about what I am doing is the raising awareness part. And I'm happy to guide and direct people and let them know what medical professionals to consider that should be a part of their team. I often talk to people, and the big piece of feedback is they don't have a guidebook. They don't know where to go, who to talk to, what medical professionals can help. And for those who are not aware about being able to advocate for themselves, and they have white coat syndrome where they believe whatever the doctor says, that can be tough when you're not aware that you can have a second opinion, get a second opinion, find someone else who may tell you something differently and or treat you differently, maybe treat you better, because it really enrages me when I hear about patients being mistreated by other medical professionals. But again, that could be a whole nother episode. Okay, back to this question. Practical and okay. So I feel that can be practical, raise the awareness, share what you're knowing with your communities, and then clinical ways. How can SLPs apply this information clinically? Well, definitely in treatment, definitely in education. Since I talked about some treatment exercises, I will talk about the education piece for patients and caregivers as well, for the clinical aspect. So making sure that the patient and their loved ones, it could be a parent, it could be the child if that patient is older, because adult patients, they may have children, and so they are part of the care team. And sometimes my patients, it is their children that are their primary caregivers. And a lot of times they don't know this information. And what I'm going to be honest, what really I I'm just going to say it, excuse my French. What really pisses me off is when my patients tell me about the horrible treatment that they have received and that they did not get the education, that they were not educated to the max, or I'm going to say to the best of the caregiver's ability, because some of the information, not caregiver, the provider, to the best of the provider's ability, because some of the information is just basic. This is not a brain injury incident, but there was a patient that I had who was receiving Botox injections to their vocal folds after suffering a stroke. And the SLP that was working with them was, and I do not speak negatively or bash other SLPs because you never know what is going on in that situation. But I can say that I don't like that this was done. So she told my patient that because of his condition, he was going to need to have Botox injections for the rest of his life. And then he came to my practice and we started working together. And I introduced the idea of an EMST device, either a 150 or a 75, which is an expiratory muscle strength trainer. They are available at emst150.com for SLPs who are interested, and that is E as in expiratory, M as in muscle, S as in strength, and T as in trainer. And they help to strengthen a lot, actually, to strengthen the muscles that are responsible for speech and for swallowing, because we use those muscles for both, killing two birds with one stone. And just, take a peek at it. The device is phenomenal. I love it, and I recommend it to my patients all the time, if it's applicable. But I recommended this device to my patient and his wife, who was in every session, so that she could help. She was a fantastic support, and they had one already. They had one already, and they said that the SLP gave it to them, didn't explain what it was, but put it in their bag for them to go home with. And that was probably a year, maybe. I remember it being a significant amount of time where this individual was taking Botox injections, because Botox injections are not permanent. They will wear off, and the condition for the vocal folds will, whatever the Botox is doing to help, when it goes away, that condition will return. So when the SLP was saying that he would need Botox injections for the rest of his life, that's why, because they don't last forever. Same thing with Botox to the face. Doesn't last forever. You have to get re-injected. So imagine how frustrated I was to find that he had been getting these injections and the device was provided to him. And I immediately educated them on the product. I implemented an exercise regimen for him, and they were an excellent, excellent couple that really supported each other. He was a pastor. The goal was he wanted to be able to preach again, and that was difficult with the way that his vocal folds or his vocal cords were functioning. I won't completely nerd out for those of you who are not speech therapists and tuning in, but when I put him on that exercise regimen and we worked on it in session, he was very diligent about doing his homework exercises and following. I will say it is a rigorous program that I put him on, but he stuck to it, and he did not need Botox injections anymore. And he was elated, and his wife was almost in disbelief because the other SLP made them think that they were going to be going, every few months for these injections to his throat for the rest of his life. And with education, they don't have to do that anymore. So I will leave that there and move on to the next question. How do you approach interdisciplinary collaboration in TBI cases, working with OTs, PTs, neurologists, etc.? Fantastic question. How do I approach it? Feet first. We, establish rapport with the people that you work with and have a nice list, a referral list, so that you can bring in other professionals that would be appropriate for the care team. And it could be that you're the one who's being brought in to the care team. So I approach it with an open mind. I think interprofessional collaboration is absolutely vital to the success of a patient's care. I wish that there was more of it. So we talk about referring, me being brought into a care team, so people referring to me, but I really think it's important that we all talk to each other so that we can verbally collaborate, have some sort of collaboration or communication network um, within the team itself. So I may be able to send an email or leave a voicemail for a neurologist or an OT or a PT. But I will say that in settings like hospitals, acute care, outpatient rehab, inpatient rehab, skilled nursing facilities, or SNFs, those are great places for interdisciplinary collaboration because a lot of times you are physically in person and on a team with OTs and PTs. So that's like the trifecta in these settings. So they'll say OT, PT, and speech, or PT, OT, and speech. I don't know why they don't put speech first. I'm biased, but that's okay. So anytime that I have to write something or I have the power to put the order, speech therapy is always first. Speechies, stand up, right? Am I right? It's just me, so I don't know if you all are cheering or anything, but yes, speechies be listed first. STOTPT or STPTOT. That's how I write it. But anyways, I'll digress. I move on. So yeah, I think feet first, be open. And I think that can help to set the tone, I hope, set the tone for more interprofessional collaboration, because in the past it has been more of a don't look at my paper kind of situation where other medical professional teams, so, the neurologist may not be talking to the speech therapist, or the physician may not be communicating with the OT, and the PT may not be talking to the speech therapist. And that is changing within the culture of the medical profession. And I am so grateful for that. So if you are listening and you are a medical professional, don't be afraid to reach out and communicate and collaborate with another professional. I like that question. Okay, next, we'll do one more of these and then we will switch to some personal questions about me. Next, how can SLPs advocate for brain injured patients when working with physicians or educators who don't fully understand the role of speech? Man, ah, that can be challenging because when the lack of awareness isn't there, depending upon the individual, sometimes, and I'm going to speak to my experience and what I have heard from physicians, sometimes they will shut you down. And some physicians, I will not say all because that's not true. Some physicians have a complex and they believe that their word is Bible, their word is bond, and you're, just the patient and listen to me because what I'm saying is correct. I don't agree with that bedside manner, treating a patient like that, especially a patient with TBI, because you've heard me talk about it before, and I'm very passionate about this. While brain health is not the same as mental health, it is related. And when you are experiencing trauma in your brain, that can look like so many different things for different people. Everybody can experience a concussion differently. Everybody does experience a concussion differently. And so when you invalidate as a medical provider, a friend, an employer, if you invalidate what someone is going through, that absolutely takes a toll on their mental health. So for a physician to be as reckless, I will say, and careless as to discount what their patient is saying that they experience, I think does a complete disservice to them and unfortunately says quite a bit about them as a provider. So I will say SLPs, like I said earlier, stand up, advocate for your patients in the way of education. So, without causing I mean, I guess it would be good kind of trouble, but don't back down. Stand up for your patient and make sure that you are documenting so that you can cover yourself. But if you know what you are saying is true, back it up with evidence, back it up with articles, back it up with data, whatever you can provide, whatever you can do. And it may be advocating for your patient and moving them, removing them from the care of certain providers. And that, it's not like speech therapists can say, can fire a physician for a patient, but you can absolutely arm your patient with the knowledge of getting a second opinion. I have a patient right now who we have been trying so hard to get her answers and for her to be believed, but there are so many physicians in her area that don't believe her because the injury is so unique. And as I've said before, the majority of medical programs in America and Canada do not have concussion curriculum. There's nothing that is set aside specifically for brain injury. And so when physicians get that title of doctor, some of them think that they know everything. And so they'll say, they'll spit back. I hate using that word, but they will spit back antiquated practices. And because they haven't done the research or kept up with the research, they don't know that recommending or telling a patient that, oh, well, you didn't lose consciousness, so you don't have a concussion, and then they dismiss the patient. You don't have to be unconscious for what you're experiencing to be classified as a concussion. You can be awake the entire time and still have sustained a concussion. So I'm hoping I'm answering that question. Advocate with education, advocate by not backing down. Educators, same thing. Educate, raise the awareness, provide the data, back it up. And I would also explain the risks if if what you are saying or recommending, like, it's, I don't know what the situation is. There are so many that could stem from this. I've heard of many situations like this where advocacy is needed. Um, but don't give up and don't back down. I have advocated so much for my patients that, um, if you all follow me and you listen regularly, you know that I have a telepractice, and I have gone to the extent of going to the hospital for one of my patients and standing in their um in their room. It wasn't an emergency room. I don't think so. It did look like a bay. But anyways, I went to the hospital and I stayed with them um until they were discharged. They were being discharged in a little bit, but with the treatment that they were receiving, I felt that she was being dismissed. And not on my watch, not to my patients when I have anything to do with it. So this just so happened to be a patient that is local. And so I went to the hospital and I stood with her and I talked to her medical providers. And I don't think that it should be this way. Medical professionals should just treat their patients well, regardless. But when I came in and introduced myself and told them who I was, people started to move quickly. They got answers. My patient had been waiting to hear anything from her doctor, and it had been hours. I got there and said that I wanted to speak with her doctor, and maybe 7 minutes is what it took for me to get a phone call to my personal phone where I was able to ask questions. Um and yeah. So I ride hard. I go hard for my patients, okay? So I absolutely would recommend not giving up, not backing down. My patient did get what she needed. It's very unfortunate that it took me coming out of my schedule, leaving what it is that I was doing and what I had planned for the day to go and be present for her. It's very unfortunate that it took that extent, but if that's what it takes, that's what it takes. So just don't back down. I think I said one more and then okay, now I'm going to go to the personal questions. Yeah, I think that's a good transition cuz I was getting a little fired up. Don't mess with my patients. Treat patients well. Treat patients right. Cuz otherwise, why are we in this business? Why are we medical professionals if we're not going to treat the people that we went to school for and some of us went into debt for, pour our money and our hearts and our focus and our study time, like going to conferences, the time commitment. What are we doing all of that for if it's to mistreat our patients or not give the absolute best to our patients every single time? And that's why it's important for medical professionals to make sure that we're pouring into ourselves and taking care of ourselves and taking care of our brains, because it's a lot to pour into someone else to that extent, which is essentially what we're doing. We are givers, we are providing service, and that can take a lot out of you. And that is a big reason why I will, if I need to take the day, then I will take the day. I have had days where I've either been overwhelmed or fatigued, or I may have been sick. And instead of pushing through, then I will reschedule patients, because as the provider, you are to provide. And if I am sick and not feeling up for anything, then uh patients probably aren't going to care that much. I mean, they care about you, but it's also like, but I have needs and I need you to provide. And in order for me to do that, I want to make sure that I'm feeling good. So I'm not, distracted by something else, like how horrible I'm feeling or stressed or overwhelmed. So a lot of times when I log on to a session, when I'm with my patients, everything that either was, concerning me or distracting me goes away. It's like this cone, or this zone, this tunnel that I get in where it's like, oh, I will say my happy place. Okay. I love working with my patients. So Yeah, I get into this zone of focus and all right, I can go on about that. But all right, switching to yeah, so that's I finished that train of thought. So I will take the break because if I mean think about when you go to the doctors. If your doctor walks in and they're like, "Yeah, I've got a this cough that I can't shake and I just, I'm not feeling the greatest." What are you going to say? You're going to say, "Oh my goodness, I hope you're feeling better." But then you're going to get back to what you need, right? You're there at the doctor's for a reason. So, I make sure that I take a break and I'm kind to myself if I need it so that I can continue to pour into my patients. Okay. If you're enjoying today's episode of Candid Conversations with Dr. Kelly, then take a second to like, share, and subscribe. Every listen helps us spread awareness, spark conversation, and educate communities about concussions, CTE, and overall brain health. Together, we're changing how the world thinks about the brain, one conversation at a time. So tap that subscribe button, like this episode, and share it with someone you care about. And let's keep the candid conversations going. Okay. Hey, this is kind of like my candid questionnaire question. Oh, you guys. Okay, what's something people might be surprised to learn about you? Ooh, so many things. People are always surprised when I say that I ride motorcycles. So I will say that I am a huge motorcycle fan. I love them. I have been riding since I was a kid. I get it honest. I get it from my dad. Shout out to my dad. Hi, daddy. He rode motorcycles. And then when he met my mom, he got her into motorcycles. Well, he gave her his old motorcycle and then he bought one. And so they used to ride together. But then they had me and the motorcycles were sold. But my dad has always been um a fan of adrenaline uh sports, if you will. And so he introduced me to adrenaline sports. And so I love it. When I was little, he bought me um little mini dirt bike, a little mini dirt bike, and he got me a go-kart. And so he would just record, while we're out there tearing it up in a field, and it was so much fun. So I have been riding either dirt bikes or motorcycles for years and years and years. So I I would say that the motorcycle thing pretty much does it for people. I mean, my patients, when they find out, they're not too pleased because they're like, "Be careful, you have responsibilities, we need you." And that actually has made me change the way that I ride a bit. Um, so I will leave that there. Next, what helps you recharge after a tough day? Hmm. Being kind to my brain and doing what I need. And a lot of times that is to unplug. So I grew up without cell phones. And when you needed to unplug, you would take the phone off of the hook. And I will do that if I have a tough day. I will disconnect. I will watch my mindless dribble. For those of you who don't know what I mean, just something that I don't have to like analyze or process. Because when you are a therapist, and a pathologist at that, we have to figure out where something is coming from, what's causing it, what can we do to help it, fix it, compensate it, heal it, so your brain is constantly going. So there's that. And then there's the multitasking aspect of things because, I wear quite a few hats and that can take a toll when your mind is going, 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 going. So I will unplug and that looks like powering off my phones and or leaving them somewhere turned off. Sometimes I'll put them in a drawer, but I will let those who need to know that I'm going on the island. So people can't reach me, but I always pop back up. But yeah, I will unplug and just give my brain time to rest. And I am an introvert anyway. People don't believe me. You all don't believe me that I'm an introvert. I am. I'm an introvert. But then some people will say that I think is it omnivert? Herbivore? I don't know. One of those verts. But either way, I like recharge. I recharge with solitude, serenity, peace, relaxation, pouring into myself, and then I can pop out. Then I can be on. Then I can hang out with you guys. But I need peace, I need quiet. I need to relax. We'll do one more. Who or what inspires you personally and professionally? I like this question. Ooh, so many. I instantly go to my mentors. If you don't have a mentor, get a mentor. Um, let's see. My line sister, Vonda, she is, if you've, been with me for a while, I've talked about her in the past. She is the reason. She is the reason there is a Dr. Kelly, y'all. So she introduced me to the field of speech language pathology. She is a speech language pathologist, and she has been practicing for decades. And she introduced me to the field, and it was just so divine, the way that it happened. So she and I were talking, and she said something about ASHA, and I was like, what is ASHA? And she explained what it was and what she did. And she was saying, you should really look into it. And I did, and I fell in love with it. So definitely, she is an inspiration to me. The way that she is so passionate about speech, and the way that she is such a good speech therapist. I mean, just seeing that as the first example that I had as a speech therapist, that is my foundation. So I absolutely look to her as an inspiration. My supervisor from grad school, who is a friend to this day, Dr. Angela Brown, she is just that girl. And I haven't talked about it in depth, but the grad program that I went through was, it's my experience. I can say it was hell, y'all. My grad school experience was hell. Not because it was hard, but because of the bullying that I experienced, and not from my classmates, from the professors, which was extremely disappointing. So, I did not have a good grad school experience at all, but the light in the storm, the way that this supervisor, mentor, now friend, poured into me and checked on me and made sure that I was okay, like she absolutely was and is still an inspiration to me. Because I'm sure at some point I will talk about this, but my grad school experience was riddled with criticism that didn't even apply to the field. So this one professor in particular, she was, telling me about my hair, talking about my clothes, and not that there was anything wrong with them. This professor was telling me that I shouldn't have my hair looking nice, that I needed to have it pulled back in a ponytail at all times. And talking about my clothes, and you coming in here with these cute little boots and shoes, and it was just a total attempt to break me down. I constantly was not asked, but encouraged or told. I was often encouraged and offered the option to quit. This field isn't for everybody. If you feel that you need to quit, you can always resign. You can always, withdraw from the program. You can, like, I was not brought with options of pull through, push through. And it wasn't even a pull through, push through situation. Like I was making A's, the occasional B. Some classes are really hard, but just constantly being told, like, oh, you're struggling. I did not feel like I was struggling. I was struggling because the professors were so horrible to me. And we can, talk about that another day. But, anyways, this particular supervisor, Angela, she really, really took the time to pour into me, excuse me, and make sure that I was okay. She invited me to different events. We are both part of the D9 family, Greek life. And so she invited me to events. I remember that she took me to this beautiful poetry event, just anything that she could to get me in a space to know that I was loved and to know that, um, just keep going, don't give up. So she is an inspiration, and we still talk and text to this day. And um, if we're talking, I'll say personally and professionally, is my brain bestie, Dr. Elena Davis. She absolutely is an inspiration. I call her the GOAT, y'all, okay? The greatest of all time when it comes to this brain injury space, okay? She is the one who trained me to become a certified brain injury specialist. So I am so blessed to have her as a brain bestie and to actually be able to call her a friend and a bestie in real life. Because I think that's funny. Some of you will comment on the people that you see often in my stories or in my posts. And I think that it's funny when you all are like, oh, you all are friends in real life. Yes. The people that you like, I'm not I'm not connecting with people for clout or anything. Like, these are my real friends, y'all. Dr. Davis is my real friend, okay? I've stayed at her house. She has come down to Charlotte and been at Brain Talk Day. We talk on the phone all the time. We're both very busy. And a lot of times that can be a voice message, but like we have to like clear the day, or it's like, okay, what day are we going to pick so that we can talk for hours, okay? And we're talking like 6, 8, sometimes more. But I love her so much. I'm going to also say personally and professionally, future doctor Ebony Green. She is a light. She is beautiful inside and out. And I just love her so much. She is like, I don't know if twin flame is right, but just like, if you know, like when you do the thing with your fingers, we're like, we here. Like, I see you, girl. Like, she is such a beautiful spirit. And I love how she is not a gatekeeper. That's a big thing of mine. Allow people opportunities, say, their name in spaces and rooms that they're not in, pour into other people. There's enough for everybody. And Ebony is, the epitome of that. I mean, her business is pouring into other people, and it's not like a money grab kind of a thing. Like, she really cares about the people that she works with and the people that she helps. So if you are wanting to scale your business and all the things, when you invest in yourself and work her program, one, it works, okay? Because she is cranking out successful SLP business owners, preneurs, as the next, as Kendra T says, and I'm going to get to her next. But yeah, I just adore Ebony. She and I have become really good friends. We send voice messages, we call and check on each other. We both have busy schedules, but I so appreciate that she takes the time. She's actually better at it than me. I will send a voice message and I will send a message via text or something, but she's really good about picking up the phone and just taking a bit for us to connect when things get busy and crazy and hectic. And you can get into the zone. I am totally guilty of that. I will get into the zone of busyness and multitasking and will not come up for air. And people have to come find me. My line sisters will be like, hey, girl, like, are you okay? So love Ebony for that, and how she pours into people and how her giving back is a huge part of the foundation of who she is. She's just a beautiful person. Um, Kendra T, the SLP, she is absolutely an inspiration to me as well. And hers is, I love the way that she is such a balance for me, because the way that I think and process a situation, I will call her and ask her opinion about it, and she will give me a completely different perspective. And because I'm not a concrete thinker and I, am open to what other people have to say and think and opinions, um, we really have great conversations, and we definitely definitely have some fun and some laughs and all the things. So there are a ton of other people. Got to mention Dr. Jasmine. I mean, personally and professionally, she's an inspiration. The way that she raises awareness for advocacy and access. We talk all the time. We FaceTime almost like every day. So yes, we are all really real friends, and there are so many people that I could list that I view as an inspiration, but we don't have all day, and I know that I said I would do a few of these. So I'm going to send all of the love to those SLPs that I mentioned, um, and audiologist. I got you, Dr. Jasmine, that I mentioned. If I did not call your name, please charge it to my head and not my heart. But if you know, you know. If you know, you know. My people who inspire me, who I love and adore, you all know who you are. So there are more questions here. I'm not going to look at them because, well, that would spoil the next episode, wouldn't it? But I will leave it here. I will thank you all for listening. If you all stayed through the entire episode, thank you so much. Thank you for supporting. Please make sure that you like and share, and we'll talk soon.